Hello, we are going to present you an article related to our theme, the NHS. First of all, we would like to clarify the definition. The NHS stands for National Health Service. National Health Service, NHS, in Great Britain is a comprehensive public health service under government administration, established by the National Health Service Act of 1946 and subsequent legislation. Virtually the entire population is covered and health services are free except for certain minor charges. The National Health Service is financed primarily by general taxes, with smaller contributions coming from local taxes, payroll contributions, and pension fees. The service has managed to provide generally high levels of health care with keeping costs relatively low. But the system has come under increasing financial strain because the growth of medical technology has tended to make hospital stays progressively more expensive. This is an article written by Paul Nuki, the Global Health Security Editor for The Telegraph, and Sarah Newway, the Global Health Security Correspondent for The Telegraph, entitled Hemorrhaging of the Nation's Health Service has now started. It's taken from the Telegraph newspaper and was published on 9 January 2021. It's taken from the Global Health Security section. This article talks about the fact that the service is in a crisis. We can see that the crisis is difficult with overworked hospitals. Some people see the COVID as a hoax and don't hesitate to share photos of empty hospitals showing that the crisis was not very serious. The biggest problem is that public opinion thinks that all this represents reality. Or even journalists show through several testimonies from people working in the health sector that hospitals are overwhelmed. The authors also rely on photos that show several caregivers equipped for the COVID sector in hospitals and on statistics that show the percentage of sick people. Thus, for the authors, the situation in hospitals is catastrophic and staff are under unprecedented pressure due to the current prevalence of COVID.
Answer the question who. The article was written by Paul Nuki, the Global Health Security Editor for The Telegraph, and Sarah Newey, the Global Health Security Correspondent for The Telegraph. These two journalists work in the health dedicated heading. The health, who is an important subject into today's society. The Telegraph is a British daily source of information, very serious and noted, whose information and source are reliable. Next, to answer the question what or what happened, this article shows the health situation due to COVID-19 in Great Britain. In addition, for questions when and where, the article was published on 9 January 2021 at the virus advanced stage and about a year after its appearance in Europe. But at 2021 starts the health situation is more and more critical in the United Kingdom after the arrival of a new variant of COVID-19, considered more contagious. The author of that article shows from the first lines that British hospitals are fighting against a very difficult situation. However, they are fearing it will be even worse and that we need to try to avoid the situation to get worse because all hospitals are not right at the end of their resources. So, we understand here that health services prepare themselves to their worst pandemic weeks. Then, for the question why, there are multiple myths on the pandemic subject, so the author tried to show the reality through that the virus is real and show what medical staff go dialing through. Finally, for the question who, the author used multiple figures of speech, pictures, graphs, testimony from medical staff, and figures to support their point.
We will now interpret the title and subtitle of the article. The title is Hemorrhaging of the Nation's Health Service has now started. The journalists in this article show your hand. In this title, the terms hemorrhage and Nation's Health Service are used, which shows that we are getting straight to the point. The authors have used the term hemorrhage. Hemorrhage can be associated with the escape of blood, but also with the loss of life. This term is to be linked to health, which is at the heart of the subject. Indeed, the title goes on to speak of the nation's health service. In this way, the authors make an analogy. They personalize the national health service, which is like a human being who bleeds to death. Moreover, in this article, we can see that the authors continue to equate the health service with a person. They use the lexical field of blood in particular. For example, they use the term bleeding in the sentence. It's much more likely that he bleeds progressively. Or on the line 134, it's going to be very bloody. But for the authors, it's more of hemorrhage than bleeding, as the experienced observer pointed out. The hemorrhage has already started. Now, the subtitle is A Drowning Person Closes off blood oxygen supplies to their extremities in a bid to survive. So it's with health system struggling to cope. With the subtitle of this article, the authors have shown that hospitals are not at the end of their rope, and that the British health system will eventually collapse because of the pandemic by comparing hospitals and the health system fighting the virus to a person withdrawing and limiting his or her oxygen consumption to the maximum in an effort to survive. Hospitals are making enormous efforts to limit death and are trying to show the reality of things in interviews. Many hospital staff are overwhelmed and struggle every day, but things are getting worse every day despite their efforts. So, this subtitle allows from the very beginning of the article to show through analogy and personalization what Britain is going through at the moment because of this pandemic. The first question we can ask yourselves is what was the event at the origin of the publication of the article? The event at the origin of this article is COVID-19. This tragic event caused many consequences. In addition to the contamination, there are many other effects such as economic, social, cultural, and health effects. This pandemic has caused many debates and conflicts because of the divergent opinions on the subject. The two authors therefore wanted to write an article on this subject because it's at the heart of current events and it's a subject that everyone is interested in. Every reader therefore feels concerned by this subject and everyone can develop a personal opinion on the article.
The second question we can ask yourselves is what was the intention of the authors? The authors want to make the population react, unaware of the consequences of the pandemic. They wish to change the population's vision by showing the truth. That is why they want to dispel the myths. Also, their intention is to support health specialists and convince us to support them. Those who were overwhelmed by the crisis, already overworked in hospitals, do not need a population who makes the situation even worse. Then, testified about British hospital situation while criticizing the NHS British health system. Recording criticism at the line 30, we can understand that the authors don't want to talk in the positive way about what is happening in London at the moment. Their affirmed demand is very strong in British hospitals. Otherwise, the article authors critique the NHS system by saying that operations against cancer are cancelled to make room for COVID-19 patient care. The authors want without a doubt to show that the British system should have been ready from the start to fight against the COVID-19 and so avoid the start of the situation where people touched by cancer are neglected for the benefit of COVID-19 patients. A priority is given to the pandemic. Also, the author critiques the number of staff who have decreased and so the health system is no longer optimal.
Moreover, journalists note that there are two visions: the vision of the COVID skeptics and the vision of the doctors. In their article, they take a real position. Indeed, their intention is to defend the doctor's point of view by scorning the COVID skeptics. In the article, the journalists use the term line 51, ignorant crowds, line 56, ordinary if weak people who have surrendered their cognitive powers, line 62, conspiracy theorists to describe the population who think the COVID is a hoax.
So, we can see that the authors does not wish to write an article only to critique the NHS system. Indeed, thereafter, the authors seem to take the defense of the NHS health system. The health system is not the only one guilty against the overflow of the hospitals. The authors want to show that everyone did not have an irreproachable behavior during this crisis. The authors show that the unconscious population also had its responsibility part in the spread and the situation being worse, because on one hand, we can see that some person goes rioting in front of a London hospital to affirm that the COVID-19 is a hoax, while inside many patients were in pain because of the virus, and that on another hand, the conspirators post pictures of empty hospital corridors on social networks. So, to defend NHS, the professor Andrew Goddard reacts and affirms that if corridors were empty, it was because the ambulatory and visiting areas were closed. However, the authors take the system's defense by showing the solidarity between the country's hospitals. Indeed, when an hospital reaches its capacity, it can transfer their patient to another hospital less crowded. Finally, the authors defend the system by qualifying as absurd the myth according to which hospital admissions are not worse than a normal winter.
The third question we can ask ourselves is, how did the authors serve her intention? Authors use several means to support their point. First of all, the authors use figures of speech. In lines 49-50 is presented a metaphor related to water, drowning. This refers to the drowning NHS in the face of the pandemic. When faced with a difficulty, don't panic. You have to control yourself and stay calm to control the situation. Indeed, they compare the situation to drowning. They insist that in the event of a drowning, lifeguards find that the swimmers don't scream and rarely wave their arms. There can be several interpretations of this metaphor. A first hypothesis would be that the lifeguards represent the caregivers, while the swimmers represent the hospitalized patients and those suffering from COVID. The caregivers advise them, as well as the lifeguards, to keep calm and keep as much energy as possible to fight against this contamination, as if we were fighting not to drown. A second hypothesis would be imagine that swimmers are assimilated to nursing staff. Indeed, swimmers struggle to avoid drowning, and it can be assumed that the same goes for caregivers who try to resist to keep their heads above water in order to get out of it, or whether to get out of the crisis. In fact, the authors are in the same drowning spirit. In other passages of the article, they use repetition to emphasize their point. For example, repeating the subtitle on line 40 to 41, the authors still use a metaphor to illustrate their point. They equate COVID skeptics with those who have invaded the US Senate. Thus, they compare the skeptics to revolutionaries who think there is a conspiracy and who question everything. So this is a hyperbole here. The authors rely on that because the purpose of hyperbole is to impact people and exaggerate to impress the reader and send a stronger message. The authors use a figure of speech at lines 64 to 65 to show that the behaviors of conspiracy theorists have an impact on staff morale and the broader public health effort. Here, through this metaphor, they want to show us that the health system is already affected by the health crisis in itself, and that this is made worse by the action of a part of the population unaware of the severity of the virus. The situation is made worse by COVID skeptics. In lines 73 to 76, the authors use the comparison. Note the like comparison tool. The professor likens empty hospitals to an empty hallway in a stadium during extra time for a football match. The professor probably wanted to insinuate that you should not trust what you see. There are explications in both situations, whether in a hospital or in a stadium. The explications are mentioned in the article. In the photo taken of the empty hospital posted on the social networks, there is no one in the corridors because during this health crisis, the outpatient and visiting areas are therefore prohibited. Space is necessarily empty. In addition, these services have been reduced to be able to deal as much as possible with the services reserved for COVID. So it's precisely because of all the work around the COVID that other services are closed and empty. So these pictures of empty hallways show the importance of the situation. Certainly, the authors use figures of speech, however, they also use pictures to testify reality. Indeed, if the COVID skeptics have posted a picture on social networks where the corridors were empty, the authors are using their photographic sources to deny the comments of the COVID skeptics. Thanks to the pictures introduced in the article, we can see the nursing staff at the heart of the action, equipped with masks and coveralls. So we suspect that this is the COVID sector, and by the way, the legend says so. These pictures allow us to understand the reality of the situation thanks to reliable evidence. In addition, they contradict the picture presented by the skeptics of the COVID. Indeed, this picture would be a proof for them, but in reality, it would rather be false proof for journalists. In their article, they put in quotes the word proof, thereby that means they don't consider the pictures of COVID skeptics to be a real evidence. Besides, they are using the article to their advantage, showing only their evidence.
The authors used many hospital staffs and people in the health fields quote to prove their arguments and prove the reality of what is happening. For example, the Professor Andrew Goddard, Royal College Physicians President, joined Sir Simon Stevens, NHS General Director, to warn against the danger that conspiracy theorists would represent for the staff morale and the public health effort in general. So, these two persons express themselves to incite the population to beware of unofficial information published on social networks. Also, following a rally by COVID-19 skeptics to declare that COVID-19 is a conspiration in front of the St. Thomas Hospital of London, Matthew, a young doctor, expressed himself by saying that hundreds of COVID-19 patients were sick and dying in this hospital. So, manifest in front of hospital is not going to fix the situation and is an action who affect the health staff. Finally, Chris Whitty, a chief doctor, once again the future, against the real problems to come up, and affirmed that we must not be too optimistic, like the NHS system could have been previously. These testimonials from professionals allow to support the saying of the authors and give real and reliable proof to readers because they are the closest people to this crisis. So the sayings allow to understand well the reality. However, we have no testimonials from people who are skeptical about COVID-19. Well, the article talks about them, but they are not interrogated to talk about what they are feeling. Therefore, journalists take a stand.
The authors also use numerical data to illustrate their point of view. For example, the authors inform us on line 8790 that the first 3 days of 2021 have reached a number that has never been reached before, with almost 4,000 patients in intensive care, but the public doesn't know because NHS has a grip on communications. No hospital can communicate information without the authorization of this one. Also, the authors show with the help of numerical data on lines 32 to 36 that hospital admissions are tough by claiming that the wait for a hospital bed now extends to 40 hours for admissions of category 3. Quantified data that is called in the back. They go on to say that admissions to the intensive care unit for heart attack and stroke have fallen sharply in recent weeks. Therefore, hospital staff must make a choice between the patients to be treated. Journalists use another reliable means to convince readers. Indeed, studies are serious sources. In the first graph, we can see that in the hospitals with the most materials, most of the beds are occupied by non-COVID patients. Despite everything, there are COVID patients, but next to the non-COVID patients, we can think that there are few. However, there are very few unoccupied beds left, so we can see that United Kingdom hospitals Even those which are in better condition at the moment are at their hand and will soon be full. In the second graph, we see the same thing but with different data because there are statistics about other hospitals in England who are now treating more than half of patients for COVID-19. The last graph shows that people who think COVID can be compared to the flu are wrong because we can see from this graph that hospitals are seeing many more patients than the last 5 winters. So, the authors want to show with this graphic that those who despise the COVID shouldn't because it's a worrying situation in hospitals.
To find out the author's intentions, we went to their Instagram account. On her account, the journalist Sarah Newway makes it clear in her commentary on the article that they despise these myths and that therefore in their article the authors try to explain some of the factors that lead to the current crisis. Thus, we can see a real position on their part. They side with the carers and do everything possible to fight against this false idea that COVID is a hoax. In addition, they try to convince readers that the situation in hospitals is catastrophic and that staff are under unprecedented pressure due to the current prevalence of COVID. Moreover, as we have shown you, the article is based on various processes. Indeed, we will able to show you the different means they use. Photos, statistics, figures of speech, and testimonials.